Hello, it's Dr. Bushore here at Balcones Dermatology and Aesthetics. In honor of Skin Cancer Awareness Month and Melanoma Monday, I want to show some examples of my patients that have had melanoma. This is a patient of mine. This is a female patient that was in her 40s that I ended up having to excise a melanoma on her leg. And I'll go through the examples of why it's so important to get these things early. If we catch a melanoma early, we have a 99% 5-year survival rate. That goes down to 65% if that melanoma has gone to a lymph node. So if we catch these things early, all we do is excise them here in my office, and we do regular skin checks all the time to try and make sure that we catch things early like this to prevent big scars and to prevent mortality. So I can show you the difference when we catch things early versus later. This is a diagram that's just showing with a small lesion these are both the same size, but if we're doing a melanoma in situ, which never left the top layer of the skin, we can do a 5 millimeter to 1 centimeter margin, and we can do a 1:3 ratio and keep it smaller. Now, when it goes deeper, it's indicated for these ones that have gone past the top of the skin and invading into the dermis, second layer of the skin, but still not super deep. We have to do a 1 centimeter margin. You can see the difference in the size, and then when you do a 3:1 ratio, how much longer that makes it. For the ones that are on the legs and extremities, we sometimes even have to extend it even longer, like a 1:4 ratio. The importance of that is we want to make sure that it blends in with the surrounding skin. So this is my patient, and you can see how long this was, but to begin with, this was the lesion we were concerned about. You can see it's an irregular shaped dark brown spot. She had noticed it changing as well. And you can see my little black A with an arrow. I do that for my biopsy sites. And that one's the one we biopsied and did turn out to be melanoma. And then we had to excise it. Lots of little tiny stitches. And then when we do it that way, you can actually have that heal really well or it disappears. So this is 6 months later. And so you can see the difference that by extending that length of that wound a little bit longer, we can make it disappear and make it look good too. Again, catching that early, 99% cure rate. It's important to keep in mind, so this is a female in her 40s, and women under the age of 49, melanoma is number 3 most common cancer. So we do want to make sure we keep an eye out for things like that, come in for skin checks, come in anytime if you notice something new or different, so we can catch these things early and remove them. I have another example. So this is another patient. He's in his 80s, and you can see another example of my black A with an arrow to it, but it was in a regular brown spot. This one was melanoma in situ, so it hadn't even extended beyond the top layer of the skin. With his, we caught that one early enough that I was able to just do like a 1:3 ratio on that, and actually close this with all the stitches underneath and glue on the top. So he didn't have to come back to get his sutures removed. And then this is what it looks like 6 months later. So again, the nice thing is if we catch these things early, we can make the excision smaller, make it look prettier, but we also increase our cure rate and survival rate, which is the most important.